This is Dr. Zelenko. I'm here to get my prescription. Hi. I'd like my prescription for hydroxychloroquine.
I can't do that.
Could you tell me why?
So the reasoning is, so you wrote that it was for lupus, even though it isn't, so that's...
How do you know?
Also, I can't give it for COVID. I'm not allowed to, dispense
Well,
it.
according to who?
According to the state, it's only allowed for it to be dispensed through a clinical trial.
Really? Could you show me the regulation? I don't think that's true.
I have one thing here. Printed it out.
What's your name, by the way?
It's Cal.
What's your last name?
I'm not telling you.
You're the pharmacist. I'm not allowed to know your name.
My name is Cal.
I think it's Cal Peshlad, right?
Sure.
Great. And who is your manager?
Her name would be Gina. I need that doctor.
So this is just a piece of paper. What's the
It came
source?
from the state.
How do you know? Where? I just want to know what is the reason why you're not giving me my medication.
Because you cannot dispense it with COVID.
And I'm asking you to prove it to me why that is. I'm a physician and I know what you are.
Alright, let me just pull up the National Institute of Health guidelines. Give me a second.
And please tell me who your district manager is.
Her name is Gina Chung.
You have her number?
I can't give you her number, but you can get it through the Walgreens. When you complain through Walgreens.com or 1-800-Walgreens, I believe.
Okay. Because I feel you're discriminating against me.
Why would it be discrimination?
Maybe because I'm Jewish? I don't know. What is it?
What? What are you talking about?
I'm not sure. Why would you not give me my medication?
It's because we're not allowed to do it unless that person is in a clinical trial.
That's not true. I'm a prescribing physician for hundreds of patients. It's just not true what you're
Yeah,
saying.
you shouldn't be doing that unless it's given an approval.
Who are you to make that decision? You're just a pharmacist. You're not licensed to practice medicine or surgery. That doesn't give you the right to control how I practice medicine. It's an FDA-approved medication, and I'm allowed legally to use it off-label. That's my right as a physician. Who are you to infringe on my rights? You're not a physician. You're just a pharmacist. Your job is to carry out the orders of the physicians.
Not exactly. I have to do it as long as it's for the well-being of the patient.
I agree. So
It's not for the well-being of the patient.
who are you to decide that?
There's no evidence of it.
It's not for you to decide if it is. I think what you are doing is malpractice. It's malpractice as a pharmacist, and I really have to wonder.
My wife is a clinician of health herself.
I'm not
She
here
would
to
never
talk about
do
you.
that.
That's okay. Your wife doesn't set policy either.
There's no evidence against it.
Again, it's not your role.
Actually against the use of
It's
hydroxychloroquine.
again not your role to make that decision. I'm a prescribing physician who is licensed to practice medicine in the state of New York, and you're not. You don't know your place. That's all.
I'm sorry, I can't tell it.
I'm asking you to justify the reason why you're withholding life-saving medication from me. That's all. I want to know why are you refusing to give me my life-saving medication.
So you're also writing it for. You wrote on the prescription it was for lupus.
And how do you know what my medical condition is or isn't? Is it your role to know that? What about
Also writing
HIPAA?
it for yourself, would you be able to provide evidence that you have?
I would, yeah. But I don't think that that's a standard of care to provide evidence to a pharmacist. I don't think that that's right. You don't do that with other people. This is not a controlled substance. This is an FDA-approved medication. So I'm asking you to present evidence to you. Again, and I have the right to use it off-label. It's my right as a physician. I'm sorry if you don't know the laws.
The evidence is A1 through the...
That what? So that's your opinion. But again, it's not your job.
It's not my opinion. It's coming from the National Institute.
But it's not your job to decide if a medication...
It's coming from PubMed. It's coming from up-to-date.
So,
There's so many clinical trials.
I understand. So it's your opinion that this medication doesn't work.
I don't want my name on a prescription that has been dispensed for something outside of the labels that has been actually been proven and been shown to be...
So you're saying, as a physician...
As a physician, I think what you're doing is wrong.
Okay, I hear that. I just want to understand. As a physician, you're saying that I'm not allowed to prescribe something off-label, and that's why you're not giving it to me?
Off-label, that's kind of more of a gray area. I think it's because the state has told us specifically...
Could I see that, please? Could you show me those statements? Because I think you're just making it up.
So that is from the National Institute.
That just says their opinion about whether the medication works or not. That's okay. They're allowed to have their opinion. But they don't govern how doctors prescribe. So I'm telling you, I need this medication. It's extremely important to me.
You're putting me in a tough situation.
Yeah, so are you. You're putting me in a situation where I need life-saving medication. You're not giving it to me. And for no reason. You're not providing any evidence, except your own stubbornness and ego. And I think that this is criminal. Criminal.
Criminal. I still have the right to say no to a prescription that I deem to be, harmful.
How many times have you prescribed this given out this medication? Hundreds. Do you do the same thing for every patient? To children, pregnant women?
We haven't given it to anyone for COVID.
But that's not your role to decide. You're just a pharmacist.
No, we follow... you're just very condescending. Just because I'm a pharmacist doesn't mean I don't know anything. But it's backed by evidence and from guidance from
Just show me the evidence. You're making statements. You're preventing me from getting life-saving medication. That is just a piece of paper from NIH stating their opinion. That is not what governs prescription patterns. You're just creating obstacles. You can't fill it. Okay, so this is Walgreens Pharmacy in 306. This is a pharmacist. His name is Kalpesh Lad, and he is refusing to give me life-saving medication, hydroxychloroquine, which I prescribe for myself, which I've been using for more than a year, and he's refusing to give it to me, and he cannot provide any evidence to substantiate his claims. So this is Walgreens in 306. Thank you.